am very excited today to have a special guest, Dr. Brenda from Pure Chiropractic. And I can't wait for this episode for our community to inform about wellness and chiropractic care. So thank you so much for watching in this episode.
And thank you so much, Yulli, for having me here. I'm super pumped and excited. So let's dive in.
Let's do it. So Dr. Brendan, so tell me a little bit, what made you choose this part of a chiropractic?
So early on, I had an impactful event in my life come up. One day, my brother and I, we were getting off the school bus, a normal day, and we're walking up to our house expecting to see my mom and dad. Until this day, they weren't there. And so our neighbor Ralph come running over and to check in on us, and he said, "Hey boys, your parents are at the hospital." And I was 13 at the time, and my dad was 42, and he had a heart attack, and he was taken to the emergency. So at that moment, at a very young age, I learned how your health not only impacts you, but impacts everyone around you. And so as I was going through schooling, two things that I really enjoyed was helping others and then the sciences. And that led me to explore the healthcare field. And it never made sense to me to prescribe drugs to mask symptoms. And then I had somebody explain what chiropractic was all about. And I got to tell you, Yulli, it was like a light bulb went off in my head and it was like, bing. And it was like at that moment, God's like, you're going to go be a chiropractor. And so I'm excited to unpack that a little bit more, because you hear chiropractic and you go to 10 chiropractors, you could get 10 different completely experiences. So I'm happy to explore that conversation further and dive in.
Yeah, no, that's amazing. So when I was in my early 20s, I went to massage school, and then I worked with a chiropractor for like 3, almost 4 years. And I loved it. I learned about how your frame works, how the fascia works, even I learned about kyphosis, how you lose the curve on your neck and the migraines. I always thought that was just fascinating. I always thought how chiropractor goes hand in hand with massage therapists, because we focus on the fascia and the soft tissue. And I always explain to my clients, chiropractic is almost like aligns your body, you know, and so for the functionality of your body. So if you we can dive into a little bit more of how chiropractic really works,
Yeah, no, absolutely. And I like your pun, wink, wink, when you say works hand in hand.
Yeah.
Chiropractic and massage. So people get around me, they know that I have kids, and there's a lot of dad jokes and puns we put into the practice here. Because as you know, many people are stressed out and can use more laughter every single day. So.
Yeah, and I was really excited about doing this podcast, because a lot of people who are new a chiropractor, I always will say, have you seen a chiropractor before? They always think about, oh, Yulli, I'm so scared. They crack my neck, they crack my back. I don't like that. So it's just more than that. And so that's why I'm so pumped about this episode, because I want to educate people from you.
Doctor means teacher, so I'm excited to educate, because... Well, and then another thing I get too is, have you seen a chiropractor? Well, I don't have any back pain. So then we got to talk about beyond back pain and what does that mean. So number one is that you're designed to be healthy. Absolutely. Okay, so let's get that clear, okay? Yeah. And can I ask your audience, do you believe that you're designed to be healthy? Yeah, absolutely. Healthy is normal, sick is abnormal. But sick has become the new norm in the United States. That's why we call it sick care. And we're in a huge crisis. If you take a look at it, just by some simple stats, $4.1 trillion was spent in 2020 on overall health.
Yeah.
And of all the drugs consumed in the world, the United States consumes 75%. Even though we only have 5% of the world's population. So if money and drugs were the solution to our healthcare crisis, we'd be the healthiest people on the planet.
Yeah.
But the World Health Organization ranks us 47th in the world in overall health. That's why I appreciate what you're doing, is bringing the health education to your client base to teach them of what they can do to become healthier and minimize drugs, avoid surgery so they can live their life to the fullest. So you're designed to be healthy. Number 2 is that your body is smart. I know you believe that. Do you believe that? Your body is designed to be smart. There's an intelligence within our body. So healthy is normal. Our body is designed to be smart. And that's the way we were created. And there's one system in the body that controls and coordinates every single function, organ, cell, tissue, and that is the nervous system.
Yeah.
The nervous system is the main system, your brain, brainstem, spinal cord, all those nerves that go out to all the muscles, the fascia, the joints, and all the organ systems within the body. And if there's any interference to that communication of the nervous system, your body is no longer going to be self-regulating and self-healing at 100%. So your very smart, intelligent body starts to produce what we call body signals. This is what people might recognize as pain. So we always say pain means pay attention inside now. It's the body's alarm system that there's some sort of stress or stressors that your nervous system and your body can't keep up with and adapt to. So it's showing signs of breakdown and that it needs help. So as a chiropractor, we look at the spine because your spine is the suit of armor that protects those delicate nerves coming from the brain into the body, and then also protects them from going from the body back up into the brain. It's like a safety pin loop, and we want that cycle to be fully functioning right there. So stress can create a condition in your body known as subluxation. And subluxation is the term described when bones are misaligned that start to interfere with the communications from the brain to the body and then the body and the brain. So simply, the chiropractor is a doctor trained to evaluate, diagnose, and come up with a care plan, all in accordance with our client's goals, to realign the structure to help take pressure off of those nerves so that all the nerves that go to the muscles, all the nerves that go to the organs controlling your immune system, digestive system, endocrine system, hormone system, sleep system, all can function better naturally and help your body cope with and become more resilient to the stress we face in modern living. So that's why I'm so excited and so passionate about this right here and helping to teach people about it, because it goes beyond pain, because by the time we have pain, that's usually a sign that a problem has been manifesting for a long period of time. We want to put you in power. That means that your body, your nervous system can exceed the stress that you're facing, and then you can perform at your peak.
Yeah, and this is a great point, because people want a fast relief, a fast day. And I always tell my clients, like, don't wait until you're like absolutely in crisis to seek chiropractic care, massage therapist, PT. Like, why can't we start now when we're like, you're a runner, oh yeah, I never get a massage. Yeah, but you're like running, you're putting a lot of stress in your body. Like, this is the time to start self-care, you know. It's just not just your body, but also your mind and soul, you know, that you need to take care of it.
100%, couldn't say it any better, because you have reactive care and you have proactive care. In the United States, sick care system is all about reaction. It's like, okay, maybe I should start changing my diet when I'm diagnosed with diabetes.
With something,
You know, does it make sense to start going to see the dentist when your teeth are falling out and your gums are bleeding? You know, ideally, you want to get ahead of this, and you go for a preventative measure to learn how to take care of your body, take care of yourself before you start to break down. So we want to inspire people to be proactive. It's like, how about your car? Are you waiting for your car to break down in order to take it to the shop? No. You go and you buy these warranties and you get regular oil changes and alignments with your car or your home. You're thinking about all the how much more important are you in making sure that you take care of your health and well-being?
Yeah, or investing in your wellness. Like people say, well, I don't have the money to go see a chiropractor, get massages regular. I'm like, you will make the money later when you get sick and go to the hospital, you know? And yes, I mean, I love this episode because it's, wow, like people, we need to wake up now, like take care of ourselves. We have only one body. I mean, that's all we have, you know?
Yes.
Yeah.
Yeah, I never believed, I don't know, if God put this in my spirit or it's just something that I never believed just going through the motions of the day. That if God has given us the gift of life, that we should be living it to our fullest.
To our fullest
So I want to, I've been married to my beautiful wife, Eros, from Venezuela, for coming up on 18 years.
Wow.
I've been honored to serve people in Vienna here at Pure Chiropractic for 18 years. It was a big year 18 years ago.
Awesome.
And we have 2 beautiful children, Kalista, 15, Kyson is 12. And I want to be the best dad I can be. I want to be the best healer that I can be. And I want that, whatever you have in your life and what you're excited and passionate about, I want to help that. I want to help your clients be able to achieve that in their life too.
No, honestly, you have been, a humongous blessing in my business. You helped me so much. We have helped so many people together, and that's just is priceless, That's what I do because it's like getting somebody better. It's just like, wow, above and beyond. Like people walking out like, I had no pain anymore. Oh my God, I had this pain for so many years and now I can walk, I can run. To me, that's just above and beyond.
Yes, and I'm going to steal this quote from one of my mentors, and it makes sense. But there's an I in illness and a we in wellness.
Yeah.
And wellness is a partner approach. It's partner with other healthcare providers who have specialties outside of the scope of what you practice in, and that's why I've been grateful to partner with you, because I know that any of my clients that I send to you, that we're going to get a good review. So thank you for making us look good.
No, thank you. And one thing I want to tell you, like one of your clients, and I think this like so amazing, this review that this client, she was coming to you, and then I guess it gets to a point where like, we have to perhaps send that client, and it happens in my practice. Sometimes we can't help them further, so we send them somewhere else, go to CPT, another professional. And this client's like, one thing about Dr. Brendan, how honest he is, because I could just keep going to him, but he was so honest, Yulli, with me. I will forever be grateful for that. And to me, it's like, wow, like being honest and to authenticity with our clients. That's what makes us unique, because we actually care about humanity, care about your well-being.
Absolutely, and that's why we always start with a thorough consultation and history and finding out who this individual is that comes to see us. This isn't like, hey, I'd like to come in and get an adjustment, let me lay on the table. I have to understand who I'm dealing with. I have to understand their history and what's going on and what tests to perform. And that's why when everybody comes in, we do nerve stress scans so we can measure exactly how their nervous system has been dealing with stress. We run imagery so we could take x-rays of the client's spines and know what's going on in their neck and back and hips and pelvis. And sometimes I got to refer them out to get an MRI because pain is traveling down in the leg, and I'm concerned that there's a disc herniation that's going on, and I need to know how severe it is to know whether they're a candidate for care, or we got to refer them to an orthopedist, for instance, where maybe they end up needing surgery because things went on way too long. But this is why we have people come in. I have had people come in, and unfortunately they're like, I have this hip pain, and we go and we run an x-ray, and unfortunately it's like bone on bone, and it's like, really want to help you, but
Yeah.
you need to consult with somebody else.
Same at my practice. Whenever we cannot, we just like, we cannot help you, Father, so you need to maybe seek another professionals because, we don't want to waste your time, waste your money. We care about your well-being. We want to make sure you get into the next step. And here you're not getting to the next step, so that is really, really powerful. But the other thing is also learning about our clients. Like you say, you interview them basically. Like I had one of my clients writing a review, and she was like, when you go to Yulli, she even asks you, how's your dog doing? How's your kids? Because you kind of get to learn of people's stress, like, okay, I've been having a hard time, or somebody dying in my family. So you get to learn, and you kind of, for us, we customize to every treatment to each patient. So we get to learn what the routines are, and we're like, and accordingly we do the work, to what they need. Maybe they're going through a really hard time, so I do sound healing, I do therapeutic work, I do some energy work to kind of calm down the nervous system.
Oh, absolutely.
Yeah.
And that's the difference, and what sets you apart from other massage therapists is you're an artist, not a technician.
Exactly.
Okay,
yeah.
we've all been to places where you go and you pay for a service, and somebody performs a service, and that's great, okay?
Yeah.
But then we've also experienced people who are artists in their craft, and there's artists in the healing art. And so I know you're one of those, so great job
Thank
on...
you.
Because we do very similar things of getting to understand our clients and knowing, all right, tell me about your work. What stresses are at your job, because people are under the gun more than ever before. I've not in 18 years heard anybody say my life is becoming less stressful. All this stress piles. Tell me about your family. And so your family, your marriage, or you're with your kids, or everything like that, relationships. I've heard it said that 95% of problems are people problems. So dealing and interact with work and with family and all the stressors, and then the demands. It's just all the pressure in Northern Virginia, and it just all this piles on of, I got to take my kids here to this sporting event, or I got this on the weekend, or got to get up earlier. There's this change in the routines, and then being in the sandwich generation, I see a lot of clients that have expended a lot of their emotional and physical energy taking care of aging parents, but then they're also taking care of their teenagers and their kids in school, and then they're getting them off to college, and they're still trying to work, and they're being pulled on both ends, and all of this that goes on, and all that stress adds up, as I know know, and I know that very well too. But it's having that personalized approach to the individual. It's not cookie cutter. It's understanding who is in front of you. There's many chiropractic techniques, so we customize the technique depending on our exam findings, who the client is, and what their goals are. So you gotta understand your clientele so you can deliver that specialized, unique, customized care to them.
Absolutely.
And they can feel it too, and they know that. So
whenever I have a client that I know is going through stress, we all have stress, but very overwhelmed situations. I tell this to each of my clients, like, this hour or 90 minutes or 2 hour session, this is just for you to disconnect. This is safe space just for you. This is no kids, no husband, no dog, no nada. It's just for you to totally disconnect from reality. Give them that space to really give that permission, because I think our society, we feel so guilty of self-care. Parents feeling so guilty taking that time off from their kids, their parents. So it's just to teach people, like, no. And I had this say, I forgot where I got it from, but we cannot serve out of an empty cup. How can we give if we're so empty? You know?
Yeah. I mean, that's powerful.
Yeah.
And how invaluable is that?
Yeah.
So if people can have that safe space and that healing and that opportunity for self-care, what's that worth to somebody? To me, it's priceless.
Yeah, totally. It really counts. That's why we have memberships, and I believe you also have the memberships for people to, like, it's a commitment to yourself. It's a commitment to your wellness. It's a commitment for you to come and recharge,
Yeah, absolutely. 100%.
I'm sure you have so many testimonials from people that you have helped. Anything that you have in mind that you want to share for the audience?
Yeah, there's a lot of testimonials I've been blessed to be part of over the past 18 years, and there's so many that would be worthy to say right here. But I want to share a story about Margie. Margie was referred into our office by her son. Margie was 74 at the time, and her son Kevin was coming into the office, and he was, he's married, has kids. He's a business owner, entrepreneur, so a lot of stress, a lot of pressure, and he wanted to make sure that he kept his body, his mind, his productivity at peak, and to be in power and get out of the pain. So we've been taking care of him, and he couldn't help but share his story and his benefits with his mom at dinner one night, all the family gathering, and Margie's like, Kevin, I'm sure he's a great chiropractor, a great doctor. He's worked wonders for you, but I've been to everybody. I've seen everybody, and nobody's been able to help.
Wow.
They've told me, here, take this medication and just stay comfortable and just live the rest of your life just trying to be comfortable with pain management. So anyways, one day she decided, what do I have to lose? So she came in with her daughter-in-law, Lisa, and I still remember when they walked in. She was walking in with a cane. You could just tell her demeanor. She was very quiet and down and pretty much hopeless. So one of my first questions I asked her, I said, Margie, you're here. What goals do you have by being here?
Wow.
And I'll never forget, it's like this wind and spirit came back into this body, and she's like, you mean I can have a goal? And so she said, I want to be able to dance again, and I want to play with my grandchildren.
Oh.
I was like, those are great goals, Margie. So we did our evaluation, we took x-rays, and on her spine we found a specific condition, subluxation, and she was in phase 2 of subluxation. So it told me it's been going on for 15, 20 years. So she saw the x-ray. I told her, Margie, we can work on this. We'll be able to help you. And she said, okay, let's get started. So we got started. Now, keep in mind, Margie was pretty well hopeless. She was living independently in the simple routine tasks, just getting out of bed, just doing the simple things, feeding herself, just doing housework were just so overwhelming for her. But she started to get adjusted, and it took time. It took time for the body to get like it was at the time, and healing takes time. It's a process. And so just visit by visit, starting to correct and those subluxations started to help improve nerve flow throughout her body. She started to sleep a little bit better.
Nice.
So she was waking up and had a little bit more energy. And then the inflammation started going down within her body, and she started to feel less pain. So then she started to feel a little bit more mobile. So then she was able to do a little bit more. And it just kept building and building. And we did her first progress evaluation after about 6 weeks under care, and we could see she was getting progress, and she was happy with her progress, but there was still something there. And I said, Margie, safe space, share with me. She's like, well, I'm a little frustrated that I'm still using my cane. I said, I understand. We want to be independent here. But remember, it took time to get like it is. It takes time to heal. So after going back and forth in her mind and kind of what you said earlier, the consistency, sticking with it, don't quit, keep going. She decided to keep going, and I'm glad she did, because we got a video of her throwing her cane to the side, and she's dancing down the hallway and everything. And she's taking yoga classes. She's dancing. She's able to enjoy her grandchildren and not have to work around activities, but she can be fully engaged. And I'll never forget Yulli. She said, Dr. Brandon, I feel better at 75 than I did when I was 50.
Oh my God, what a testimony. What a beautiful story.
And it's her and others that continue to inspire me to get out of bed, to continue to help lead this charge, to help reduce stress and pressure at people's spines, their nervous system, and doctor means teachers, to help educate them on what they can be doing to become an active participant in their overall health. And what I'm talking about is sleeping well. I'm talking about eating well, taking their nutritional supplements to reconcile deficiencies in their nutrition, getting exercise in, hydrating, stress management, positive mental attitude, and then also collaborating with health professionals like yourself so that we assist in the overall health and wellness of the individual and helping them become that version of themselves that they see, that they want, and they want to be living as their best self.
Absolutely. Honestly, that's our goal for each individual, to live to the fullest. We only have one life. Live it to the best. I mean, really, really take care of yourself. And the more you take care of yourself, the more you can give, the more you can be yourself and feel yourself.
That's right. Start to fill that glass back up.
Absolutely, your cup. Fill up your cup.
Fill up your cup.
All the goodness. Yes, absolutely. And also one more thing with you do like educational classes. I think that's so powerful. Do you do them weekly, monthly, or how that works?
So we tackle a topic every single month that is kind of in season, if you will. So last month was all about detoxing from holiday stress and reclaiming your energy. Nice. So we were teaching our clients how to boost their energy naturally. Okay, not with like 3 5-hour energy drinks and 10 pots of coffee.
No.
Okay. But then this month is all about boosting your immune system, fortifying your immune system, and how your nervous system and immune system are intimately related. And your immune system is only as good as how well your nervous system is regulating stress. So we're going to take a deep dive on that later this week. So every month, next month is how to bulletproof your lower back.
I love it.
Spring's coming. People are going to be outside more. They've been sitting too much in the cold, avoiding the cold. We've had snowy, icy sidewalks. Health routines get disrupted. And now they're like, hey, I got some freedom back. It's sunny. Yeah. It's warm. So let me go do this yard work. Let me start exercising again. And when your body is deconditioned and you jump in too fast, too soon, that can be a stressor that overwhelms the body and your body can fight back. So once a month, we like to do these educational topics to empower our patients, teaching them outside of the office of what they can do. You know why?
To continue, with their wellness.
Exactly, and they don't screw up my work. Or they don't screw up your work either,
exactly.
Okay? So
I always say to people, they be like getting this very, very deep work and body work, and they're like, Yulli, can I go work out now? And I'm like, just take it all in today. Not today, tomorrow maybe, but not today. Give that permission to yourself to just take it all in, no workouts today.
Sure.
So sometimes
that's great advice.
Slow down and And no, but honestly, and thank you to Lynn for introducing me to you and get to know you. And oh my gosh, how long did I know you? At least 5 years, at least.
No, it's got to be longer than that.
Longer than that, right?
Lynn's been here almost 10 years.
Are you 10 years?
So
oh
at least 10 years because I've known Lynn before that. So.
Yes, oh my gosh, I'm very, very thankful to her for again introduce me and all the impact that we have made with our clients, and that's just priceless. So if you have a message for somebody who is suffering, who doesn't believe in chiropractor, doesn't see hope anywhere else, what would you say to those people?
Well, I mean, really what I'd say is one of my mentors said it best was, above all else, never take hope away from anybody. So if you're still breathing and you still have life in your body, simply put, the next step would be coming in for an evaluation. As Yulli mentioned, we can't help everybody, but there's a lot of times that we can help. And we can help get you on the right trajectory, take the next step. But it all starts with a thorough consultation to identify if you have subluxation or not, and then report all that back to you and help educate you more about your health and what's going on in your body. Oftentimes people will come in and say, how come no other doctor has ever taught me this or shown me these type of tests? It's very unique and it's very specialized and it's very empowering. So that if we are able to help, we'll give you a set of recommendations. And simply, I only base those recommendations off of two things. It's my clinical findings and what your goals are. And then it's your decision of what you want to do moving forward. And then always how we collaborate in your responsibility and what you can do to help your health and well-being, and how other healthcare providers like Yulli can help also.
Thank you so much for listening to this episode. Thank you. And if you know anybody who's going through chronic pain, any physical pain, please share this podcast. Thank you, and I will see you in my next episode. This is for men or women. It's a kind of sensitive subject because we don't like to talk about this, but we have an amazing machine here called Encella. It helps to strengthen your pelvic muscles. You come and sit down with clothes on. It's not invasive treatment. In 29 minutes, you can get about 11,000 Kegels that help women when you're playing tennis or pickleball or jumping in a trampoline with your kids and you have accidents, or you just can't wait for the next exit to catch the bathroom. You don't need to suffer. We have this amazing machine. It's been around for a long time. Every client that has used it so far, great results. It really can help you to improve your lifestyle. And I can't wait to see you. Please sign up for a free session. Come and try it. You will thank me later.